I'm Tyler Good, the Director of PR at Southwestern Community College, and my co-host is Michael Despo. He's our Director of Career Services at SCC. The main reason we started this digital series is to help people who've lost their jobs due to COVID-19. Unfortunately, that includes a lot of people in our service area. USA Today reported just yesterday that more than 44 million Americans have lost their jobs over the past 12 weeks. The good news, though, is some of those are now going back to work. One term we've heard a lot about during this season is essential workers. And no one, I think, would argue that healthcare workers and providers are essential. Today, we're really honored to be joined by Steve Heatherly. He's the president and CEO of Harris Regional and Swain Community Hospitals. He's going to give us some insights into how the pandemic has changed their operations, and he can also provide an outlook for healthcare fields that are in the greatest demand at this time. At SCC, we currently offer training in 14 different health sciences fields, and we'll soon be adding more. Speaking about those today will be Dr. Mitch Fischer. He's our Dean of Health Sciences, and he oversees all those programs. He spent many years training respiratory therapists that are on the front line of this pandemic. And I'm looking forward to hearing his take on what's happening and what the future may hold. We'll also be talking about a major construction project that's underway on our Jackson campus. Our leaders may not have had a crystal ball, but they planned this new health sciences building long before any of us had heard of COVID-19, and it's clearly a wise investment. We'll touch on that in a few minutes, but for now, thank you to everyone for joining us. We've talked about a lot of employment fields in our region the past few weeks: automotive, EMS, first responders, small business, even tourism and hospitality. Mike, I know you're constantly staying on top of the latest employment trends. What is the employment outlook for folks who are in or plan to go into healthcare fields?
Well, thank you, Tyler. The last few weeks, I threw out some statistics that are emerging and that we've been following pretty closely that apply to pretty much all sectors of employment. And I just read a Forbes article yesterday that suggests that our real unemployment may be nearing 19.5%. And I can also tell you that a study of North Carolina community college students across the state report that 75% of all students have either lost their jobs or seen their wages cut. And so people are feeling that pain and uncertainty right now, for sure. Now, as of a late spring survey, something along the lines of 44% of local employers were looking to be hiring in the next several months. And we're into that now. And we saw some of that happening last week with our hospitality and tourism. Now, you used the word essential, and I can't think of a more essential type of a job or career or person than a healthcare worker. And so we know, and we've known for a long time, that the job security and the certainty of gainful employment is very high in this whole sector. As far as making sense of the very immediate current scenario, I'm glad we've got a couple of experts in the room, because for me, that's a little bit of a moving target. And we know that long-term, the likelihood of good, solid employment is extremely strong, certain, really. But with elective procedures and care being taken a back burner to certain other pressures right now during the pandemic, we've all heard that certain areas of healthcare are cutting back, others are desperate to hire, and so in the immediate moment, I'd say that it's hard for me to get a sense of the pulse of that. However, we're going to talk about that today, and we're going to see where our graduates are going. And one thing is for sure, SCC is positioned to help people find the right healthcare position. Anybody who wants to be in that caring professional role, who wants to serve others in this way. We've got this new building coming online that we're going to hear a little bit about today, and we've got 14 programs, all of which Career Services works with, and I have a front row seat to seeing these students find gainful employment, and they're very valued and very heavily recruited in this region. So,
throughout our history at SCC, one of our real strengths has been building partnerships and relationships in our service area. Can you tell us a little bit about the relationships that you, our faculty and staff, and our administration have built and continue to nurture with our healthcare providers in our service area?
I'd be delighted. This is really underpins. This is what makes us strong together as a team. Career Services positions itself to be sort of what I call a critical nexus between a lot of different, very important partners. First of all, I can't tell you, I just would have to rattle off all their names, but the faculty in our health sciences program have their students' career success, not just their critical training for these essential positions and their their education as professionals, but also they want them to have the self-efficacy to succeed, market themselves on the job search, and present these skills. And so we've occupational therapy, physical therapy, nursing, medical sonography, radiography, human services technology, wilderness therapy, and really a number of other programs have worked very closely with Career Services over the last almost 5 years I've been here to plan mock interviews with real professionals to take full advantage of our resume and cover letter assistance and our big interview technology program, which is very robust, our job board and our job fairs. And so really everything that we offer, we do so in partnership with faculty, and with the help of faculty, we're able to partner with employers like Harris Regional Hospital is a great example. We just in February had a nursing and other allied health career panel to help students understand what it's like to transition into a professional role. And we had Marie Folks, the manager of Med-Surg, and Autumn Neeson, I think she directs or manages inpatient services. They came and participated on our panel, and it was so very well received. I think in the room, and they really shared a lot of just very, very important wisdom and advice with those students. We've had dozens and dozens of healthcare practitioners from across the region and in different professions participate in professional mock interviews every spring with the same cohorts of students in all of these areas. And it's just very impressive the way people are willing to roll their sleeves up and come to SCC and help our students succeed even before they're able to then, maybe capitalize on some of those relationships and bring those students into their workplace. Becky Wiltz, the HR director at Harris, has come to, I think, every single career fair that we've held. We have a healthcare specific one. Healthcare has gained so much focus and it has such importance that we broke that sector out of our large career fairs a year ago. And for the second consecutive year, we had a healthcare specific career fair the first week of March. And Becky came, as she always does, and represented our local hospital here in Silva. And so I just can't say how important these relationships are to us. So, yep.
Speaking of those, turning now to Mr. Heatherly. Thank you so much, sir, for joining us this morning. Can you start out by telling us a little about some of the most significant ways that Harris Regional and Swain Community Hospitals have been impacted by this pandemic?
Well, I think, so first of all, thanks for having me. And I think that, the pandemic has been obviously something that has been an uncertain environment for the country and for our local healthcare system. So I think we've had to be, cognizant of making preparations for the worst case scenario, hoping the worst case scenario never happened. And fortunately, that's been the case. So we, in essence, in mid-March, shut down many of our elective operations. We stopped doing elective surgery. We stopped doing elective imaging procedures. We became very careful about the numbers of patients who we saw in our outpatient practices. We continued, of course, to operate our emergency department and our urgent care center. And So there were two aims in making those moves. The first aim was to do our part in stopping the spread of the virus so that people would not be congregating in our facilities. Obviously people who are sick or have some healthcare condition that might make them more susceptible to the spread of the virus. So that was goal number one. And then goal number two, because we didn't know what we would experience in terms of patients with the virus coming into our facilities, we needed to preserve our PPE, personal protective equipment. And so the news is, I think, in our region, we've seen pretty minimal impacts clinically from the virus. And when I say that, I mean, obviously, we've had people sick, we've had people test positive, we've had people who are who have been admitted to the hospital, but the fact is that that's happened in relatively low numbers, and so the real impact for us has been the other parts of the healthcare we need to deliver have been delayed. And so about 5-6 weeks ago, we started back into that process. We started opening up in a really conservative manner, elective surgery, elective imaging. And now I would say that we're at about 80 to 90% capacity. We are very respectful, though, of, people have a lot of anxiety about this virus. We don't push people into receiving services. Obviously, there are those who take a really conservative perspective about where they go, and they haven't wanted to come into the hospital necessarily. That's fine. And then the general economic conditions mean that there are those folks who simply are out of work, may not have health insurance, and they need to postpone things. But we see ourselves getting back closer to normal operations. The fact is, I think it's going to be a new normal for a while, driven by both the virus and general economic conditions.
There's really no playbook or blueprint for this. I mean, it's all new to all of us. But I was curious. I wanted to ask you, what's an example or two of some ways that your team has responded during this unusual season that has particularly made you proud?
A couple things come to mind. I mean, this is going to sound, not glamorous, but the reality is that our people showed up for work ready to take care of patients during a time of great uncertainty. The fact is, even today, we don't know when the next COVID-19 patient is going to come through our emergency department. We don't know who that person is, where they may be, the state of their illness, and we've taken every precaution we can think of to protect our staff, to protect patients who are coming in. If you can think back to mid-March, when this really became in vogue nationally, we knew next to nothing about the virus. We didn't know for sure how it spread. We didn't know what the prevalence was going to be in our community. We didn't know how contagious it was really. And every day something changed. And I'm just really proud of our staff who continue just to show up and do what they do. And that takes a lot of courage. And they demonstrated that courage, I think, because of their commitment to our communities, to the people that they work alongside, their neighbors, the people they go to church with. The other thing I think a time of uncertainty does is it shows the strength of your team or not. And I'm grateful to say that the strength of our team has been demonstrated in the sense that literally every day as healthcare provider, you get guidance from the CDC, from the state. We're a part of a large company that operates 85 hospitals across the country, so we would get guidance from our parent organization, and that changed on a daily basis as were learned about the virus and about best practices. And I would just say that our team came together. We were adaptive. We did things like early on, for example, we recognized that in some of our patient rooms, in the ICU in particular, that we didn't have an environment where people could walk out of a patient room, take off the personal protective equipment and stow it in an area where they may not expose others to it that were outside that room. So our facility, our nursing staff identified that. Within a matter of about 2 days, our facilities staff had constructed antechambers around those rooms so that now our caregivers can step out of the room. They're in a secure, protected area where they can take off those clothes or other elements of personal protective equipment, leave them there, and then come back out into kind of the general area. So that's those. I could give you a dozen examples of where on a daily basis we learned something new, we identified a gap that we might have, and our staff came together as a team to figure out solutions to that quickly. One more example I would give is just the way we go about screening patients. We decided early on that we needed to set up screening stations at every entrance to all of our facilities so that we were screening employees, patients, visitors, anybody who was coming in to help try to protect folks and stop the spread of, or at least mitigate the risk. And we set that up very quickly. We had to ask volunteers to work in some areas the clock because we're a 24-hour-a-day, 7-day-a-week operation. And so people just volunteered. Still to this day, we have requests going out. Hey, we need to cover the night shift on Saturday, which is not glamorous, but people volunteer to do it.
That's particularly impressive. Before we kind of came on the air here, you were telling me you have 17 different locations. And when I think about the logistics of having a screening station at that many places, that's very impressive. And I think it also probably, I know it gives a lot of more confidence to all the people in our service area, that our local hospital, to hear about these steps y'all are taking. A lot of the folks who are listening today are really hurting, like I mentioned earlier. I mean, so many people have lost their jobs, and I expect many of them are looking for some kind of a new career that might be pandemic proof and essential in this economy. What specific fields in the healthcare industry do you see that are in the most desperate need of more workers?
Well, we're in a perpetual search for nurses, technicians, radiology technicians, lab technicians, physical therapists. I would say those clinical positions in particular are going to be, they're currently in high demand, and they're going to be in high demand. Now, the reality is that in a pandemic, environment where we're postponing, or we did postpone some elective procedures, we obviously had to make temporary adjustments to our workforce in the face of that. But as we have ramped back up, we see that changing. And I think the long-term, even the intermediate term outlook for employment in the healthcare sector should be pretty solid. And so we're going to be, in the business of continuing to hire those nurses and technicians that are vital for us to do what we do. The good news for us is, even through the pandemic and even through having to make adjustments to elective procedures and all of that, we continued to do things like build our new cancer center. We continued to plan for opening a location in a new area, a new part of our service area. And now we continue to recruit new physicians. We had a new general surgeon start on June 1st. We had a new OB physician start, I think, in March. And so we're going to continue to grow. We're going to continue to focus on expansion and reducing barriers to access to care. And those things are going to lead to us needing more people, not fewer people, in the long term. I think I would say that's the reason our partnership with Southwestern Community College is so essential. A big number of the folks that I just described who we hire in the local job market receive some portion of their training at Southwestern Community College. And so we consider the college to be an essential partner in us doing what we do.
I know that you referenced our partnership, and we were talking about that earlier, how essential that is for our communities, really, that we work well together. And I know you and Dr. Thomas probably came into your current positions about the same time. Our president, Dr. Don Thomas, and the rest of our administration, I know they work with you and your team. Can you talk a little bit about how that partnership works, just that process?
Yeah, I mean, you're right. We did get acquainted early, kind of in our tenures in our respective positions. Obviously, we knew from a hospital perspective that the community college decades had been an essential partner, and that the importance of that partnership was only going to grow over time as we want to grow services. We want to be the hub for healthcare for the rural parts of Western North Carolina, and that's why our workforce, a growing and expanding workforce. So we continue dialogue. Obviously, we're a destination for clinical rotations for all of those disciplines that I talked about. And then we formalized an element of that partnership we called it the Student Nurse Apprentice Program. And that's where we will pay for people to go through training at Southwestern Community College and then essentially guarantee them employment following their training. We focused on nursing to begin with, but I suspect over time we're going to need to expand that program to include other disciplines as our needs change. And so, again, it's always been a formal relationship in the context of the clinical rotations. There's a great degree of informality. I mean, Dr. Thomas is now on our board, on the hospital board, and a great board member. So we have frequent communication about what's happening at the college, what's happening at the hospital, and how we can bring those needs together to meet the needs of our region. So really important, and I think we'll just continue to build on it as time goes on.
Thank you. Thank you. Turning now to Dr. Fischer, Dr. Mitch Fischer. I know we mentioned earlier that we currently have 14 health sciences programs, and I'm always impressed with how familiar you are. I mean, not just with those programs, obviously, but with the students who are in them. Every year I go to the pinning ceremonies, and you talk about the roles that each of those programs have in our community and everything. But your background is in respiratory therapy, and that has been just such a critical field during the pandemic. I wanted to ask you about that. What is your take on respiratory therapy and why it's been such a critical field during this pandemic?
Thank you, Tyler. COVID-19 is primarily spread through respiratory droplets. So when someone sneezes, coughs, or even talks, and you are less than 6 feet approximately away from that patient, if they are infected, you stand a good chance of becoming infected. And what COVID-19 does is it gets into the body and infects a cell with virus. That virus multiplies and then affects other cells. And the virus kind of likes a warm, moist area, which basically describes the respiratory system. Once it gets into the body, it starts destroying the alveoli or air sacs in the lungs, requiring patients to go on to mechanical ventilation. And the respiratory therapist is the primary operator of the mechanical ventilator. Today's mechanical ventilators are very highly technical and highly advanced pieces of equipment. And that mechanical ventilator can do more harm than good to a patient if the operator is not trained in exactly how to operate the ventilator. We train our therapists for one entire year strictly on critical care and mechanical ventilation. And when they finish, they are, I would have to say, slightly more than an entry-level therapist and can work in an ICU in most hospitals. We've had many students hired directly into intensive care units or pediatric and neonatal units because of their technical skill and ability. We put an emphasis on the fact that you are not just dealing with a machine, but there is an individual that is attached to that machine. And one of the things that I have always advocated for and trained for, as do our current respiratory faculty, is that the patient comes first and the machinery comes second. And you have to work with both, train to be empathetic to patients and their families while being an expert in operating these technical mechanical ventilators.
Thank you. Thank you. And as I alluded to in the intro, we've got this new $21 million building under construction on our Jackson campus. We're about a year away from hopefully being able to open that. But I wanted to ask you, what kind of impact do you foresee that will have on training future generations of health science professionals in our region?
That building is going to have an enormous impact on our current programs and on our new programs that are coming in. We are going to be able to add students to every single program in health sciences because of the added space in that building. The needs in our community for well-trained healthcare professionals are only going to increase, as we've already said. That being the case, expanding our offerings and expanding our openings will allow us to fulfill that need. We're also going to be having a community clinic at the first floor of the building. And that community clinic will be a training ground for our students. They will get experiences that they may not otherwise get in the clinical sites. They will be under the supervision of our faculty. So virtually everything they do in that clinic will be a teachable moment and will greatly enhance the benefit to the community as well as to our students. We're also going to be expanding our simulation labs. I would have to say that after visiting other community colleges and talking with other health science deans, we have what is probably the strongest simulation partnership or position in the North Carolina Community College system. We have spared no expense. We've gotten the best state-of-the-art mannequins that can do almost anything that a person can do. We've gotten an anatomage table in 3 locations, which details anatomy in ways that was unthinkable 10 years ago. As a result, our students are better trained, are able to see things that they may not normally see, and we don't have to worry that they're not going to be fully trained. We can control every situation. We can provide for their training in a way that the only way to really know what we're about is to see our simulation labs in action. And we invite people to do that all the time. Our students and faculty do a fantastic job of bringing the mannequins to life, shall we say. In the new building, we're going to have double the size simulation lab that we have in the current building. We are going to be breaking those rooms down to specific disciplines. We're going to have one whole room just for the anatomage table so that students can study anatomy in depth. We're going to have another room that is going to be a birthing center. We're going to simulate everything from birth to newborn resuscitation and newborn care. We're going to have another room that is going to be an intensive care unit where we're going to be doing any number of things that occur in typical intensive care units. And I am most excited about the two new programs we're bringing on. Surgical technology is an area where there is great need across our service area. We are going to having a surgical technology suite in the new building with a simulated OR. We're going to be having mannequins that we can do simulated surgeries on. And we are going to be training folks to be able to step right into those positions at graduation. The other program that we're bringing on is a little outside of the normal realm of healthcare, and it is opticianry. Over the years, we've gotten many requests from area optometrists and ophthalmologists for training folks who can make and fit glasses and contact lenses. There is only one college in the entire North Carolina system that does that, and they are 6 hours away from us. So we felt it was time to bring this service to our community. An added benefit of bringing the service to our community is folks will be able to use our clinical opticianry lab to purchase eyeglasses and contact lenses at cost. And our students will make those glasses, fit those glasses and contact lenses, and get the clinical experience they need to become practicing opticians.
That's exciting stuff. Just thinking about how we're going to be expand what we already do, because what we already do is really impressive, and being able to have this new state-of-the-art space is going to take it to a whole other level. Thanks for describing all that, Dr. Fischer. With the time we have remaining, I wanted to give each one of our guests just about 30 seconds or so to cover whatever maybe we haven't touched on yet. And I'd like to give Mr. Heatherly maybe a few extra seconds, because I'd like to hear your impressions of this new building and thoughts as you hear kind of what Dr. Fischer has mentioned. So if we could just start with you, Mr. Heatherly, any closing thoughts?
Well, first of all, with respect to the facility, we think that's going to be an incredible asset to our region, and are so excited to see that vision, Mitch's and Dr. Thomas's vision for that facility come to fruition. I know that our organization will benefit greatly from expanded programs and access to a talent pool that we're going to desperately need as we grow and develop services going forward. So thank you all for your commitment and the vision. You know, when you do things like that, it's not always a straight line to seeing those things become a reality. And I appreciate y'all's commitment to that. I would say that just in closing, you know, I've said this to some other folks, and I want to make sure I say it every time I have the opportunity. This COVID-19 thing has been unprecedented. I joke that I've used the word unprecedented more in 2020 than I have in my entire life. And I think we're going to continue using it, because I think we have a lot left to learn and a lot left to figure out about how we go about our lives in this new normal in the face of a COVID-19 pandemic that is not going away. And we're going to have to figure out how we do what we do, while dealing with the realities of this virus. And there's been a lot of attention focused on healthcare workers and referring to them as heroes, and that is absolutely accurate. See those people in action in our hospitals every single day. I just want to take a moment to say that there are a lot of other heroes in our communities, ranging from folks who work in grocery stores to folks who work in restaurants. That industry has been hit so hard by this pandemic, and now we see some of them being able to come back and reopen. But the fact is that through all of this, now, a few months into it, we've all been able to live relatively normal lives because a lot of people decided that they were going to show up and they were going to serve food and they were going to stock grocery stores and they were going to make things available to all of us so that our lives could be as livable and normal as possible. Certainly, our public servants. And so I just want to say thanks for our community's support for our healthcare workers. And we thank all of the other folks who have equally been heroes to allow us to have normal, livable lives as much as possible.
I appreciate you pointing that out, sir. That was really good to hear. Dr. Fischer, any closing thoughts?
Yes, I would love to thank Steve and his facilities and his people. When this COVID crisis hit us, we had to transition very quickly to doing things differently than we've ever done them before. And we've lost many clinic sites, and it's been a challenge to get students through their clinical training. But all through the crisis, Harris and Swain and your ancillary sites have stuck with us and made arrangements for clinical training to continue. And for that, we are eternally grateful.
Our pleasure. Thank you.
That's that partnership we were talking about earlier in action. And if we're needing to more quickly get more healthcare workers into the system, that helped expedite that. So that's good to hear. Mike, any final thoughts?
Yes, thank you, Tyler. I began by talking about and describing all of the partnerships and the work that we do in career services to bring employers and students together. And that's a very critical role. But I want to talk a little bit about our other really important role as well. On the front end, if you're interested in a healthcare field of any kind, career services provides a lot of tools, a lot of information, a lot of support and guidance to help you make that decision. So you can come in, any aspiring student or current student can come and see Jody Waldrop, our career counselor, or myself, Jody. We actually, I don't know if everybody knows this, but we hired her. She was a professional academic advisor for a nursing program in Georgia. And so she brings that certain expertise. And we've got career counseling staff, as well as a lot of technology tools, and we'll put information at your fingertips and help anybody make the right decision about a career in healthcare and which one might be right for you. And I'll just wrap things up by thanking Mr. Heatherly and Dr. Fischer for coming today. I think each of them sort of symbolize a whole faction of those people that career services partners with to help students succeed. And so thank you for representing our healthcare employment and our healthcare education. Both of you, thanks very much for your partnership.